somebody asks a question, at least I'll kind of have an idea what's going on out there in terms of the other two.
We will begin the meeting in about 3 minutes. We will begin the meeting in about 2 minutes. We will begin the meeting in about 1 minute. Tracy, I have 2 o'clock.
All right.
Are we sounding okay?
You're sounding good.
All right. Shall I begin with an update?
If you want to, that sounds great.
All right. So, of course, we post our updates on our website and social media page. Since we've got a lot of discussion today about vaccines, I won't get too deep into the cases. I'm going to give a total for each county and then some overall numbers. So we've had 1,409 cases in Adair, 978 cases in Casey, 1,129 in Clinton, 511 in Cumberland, 883 in Greene, 1,314 in McQuarrie, 4,494 in Pulaski, 1,294 in Russell, 2,011 in Taylor, 1,739 in Wayne. We've had 15,762 total cases in our district. Right now, as of yesterday, we have had 284 deaths in our district. We've released a little over 90% of our total cases. 14,480. We continue to have 998 active cases. 923 of those are isolated and 75 in the hospital. We were looking at our numbers. It took us 6 days to get from 11,000 total cases to 12,000. It took us 9 days after that to get to 13,000. That happened on December the 28th. But since then, it's been speeding up again. It took us only 7 days to get to 14,000 total cases. That happened on January 14th. And it only took us 4 days to get to 15,000 cases on January 8th. So that was the quickest it took us to add 1,000 cases since the onset of the outbreak, those 4 days right there. Our 7-day incidence rate, 34 cases on 34 cases per 100,000 average per day in Adair. 64, almost 66 in Casey. 184, almost 185 in Clinton. 103, almost 104 in Cumberland. Almost 64 per 100,000 average per day in Greene. 80 cases in Macquarie, almost 101 cases in Pulaski, almost 68 cases average per day per 100,000 in Russell, 87 cases per day in Taylor, and a 7-day average incidence rate in Wayne, 1,100 or 111 cases a day, almost 112. So 112 cases in Wayne per 100,000 for 7 days. So we still have a lot of cases in our district, a lot of growth. The last few days of last week and the first few days of this week, it looks like it may be slowing down a little bit relative to the week before. That's not a long enough time to know if we've truly plateaued again or not. This most recent surge seems to be coming off of the holidays. There's a tremendous amount of cases that are tied back to holiday events, family gatherings, and so forth. So, if you had a pretty substantial family gathering and someone in the house had it and everybody had their masks off and was laughing and talking, it probably spread to several other people. And they probably spread it to several other people and so forth, and that's how we arrived at the numbers we're having right now. I guess the bigger story is vaccination and the amount of confusion and frustration that the public has right now is large, and the amount of work it's causing on us because of that confusion and frustration. And what I mean is we're getting inundated with phone calls and emails trying to get answers to things that we just don't know the answer to yet. But to just put a couple of things in perspective, there's 2 drug companies right now supplying vaccine or producing vaccine that's approved for the United States. Is it 4, Dr. Wayman, that's approved in other countries, maybe 4 on the world scale, somewhere in that neighborhood?
Oh, there are probably more that are approved, but like
in different countries?
In different countries, right. But we only have 2 approved. England has 3. Yeah, and we are waiting for another one, Johnson & Johnson, to be approved sometime in the next month.
In any event, it's a handful of drug companies, period. And they're trying to produce enough vaccine for the entire planet. And the amount that is being divvied out to Kentucky, I don't know of any way to make that amount be greater. You can complain to me, or you can complain to the governor, or you can complain to the president, or to the drug companies that's making it, or whoever you want to complain to, that there's only so much vaccine that can be produced. And the allocation that's coming to Kentucky, it is what it is. And the amount that's going to be allocated to Lake Cumberland is if Lake Cumberland gets, right now there's about 50,000 doses of vaccine coming into Kentucky a week, and there's 4.5 million people. And if we got our proportion of the state's allotment each week, it would be about 2,300 doses a week to spread out over a population of 200 and around 200,000 people. Of course, not everyone's going to get the vaccine. Kids won't get it. Some people will pass on it. But, even if you're talking about 100,000 people that want it, and you're only getting 2,000 doses a week, it's going to take you a terribly long time to get the vaccine out to everybody that wants it. Now, maybe other drug companies will get approved and the production will get ramped up. But for now, at the pace we're getting the vaccine, even to work through the 70 and plus age group, once we're authorized to give the vaccine, it's going to take probably several months to work through that, unless something changes to where there's more vaccine produced. And again, these companies are trying to make this vaccine on a planet-wide scale. So, as far as I know, just as a general statement, as far as I know, there's no place in Kentucky that's been authorized to order vaccine at the 1B level. Everybody's still supposed to be at 1A, which is medical staff, hospital staff, nursing home residents, and long-term care staff and residents. Now, if you have ordered vaccine and you can't vaccine at the 1A level and you can't get it all administered to folks in that group, people have been approved to go ahead and give whatever leftover amount they have to the 1B group. So there are places that you hear about that's given some vaccine to schools or to 70-year-olds or whatever, but the best of my knowledge, that's not because they ordered one phase 1B vaccine. That's because they had some leftover phase 1A vaccine. And again, as far as I know, nobody's been authorized to move to ordering 1B vaccine. Now, I may be wrong. There may be a special circumstance somewhere in the state where somebody's got something worked out with the government, but as far as I know, that's the situation. So anyway, all of our questions today have to do with the vaccine. I'm sure I'll say more about that in a minute. Tracy, is there anything you want to say to kick us off?
I guess I want to remind people, if you have questions, to type those in the chat box, and we will answer those as we walk through the meeting today. And I'm going to go ahead and start asking. I'm sorry.
Somebody posted in the chat on YouTube, it says that we are frozen and not transmitting. It looks to me like, from what I can see, we are transmitting. So maybe we were froze for a minute, but unfroze now. In any event, I'm sure we will have the opportunity to repeat most of what I just said as we move through this. So.
Okay, I'm going to start questions. Has Lake Cumberland District Health Department developed any type of protocol to determine which of those age 70 or older are willing to take the vaccine? And also, will there be a district-wide survey? And then they go on to say, I've read a Pew Research survey from December stating that 34 to 40% of the public were still not willing to take the vaccine.
Yeah, so have we decided who age 70 and older are going to get the vaccine? I guess you're asking, have we subdivided that or decided how to prioritize that? The answer is no. The State Department for Public Health has set the criteria to be 70 and older, and that's what we will follow. It says, have we done any type of survey to see how many people will take it? No, we haven't. There's a reason why we haven't, because we know the amount of vaccine we're going to get per week whenever we're allowed to start ordering it is going to trickle in, and there's going to be way, way more demand for several weeks than we have supply. So there's no real logic of me assigning my staff the task of doing that type of work when we know the answer is we're going to have more demand than we have supply. So, there just wouldn't be a reason to do that right now. And it may be that only 50% agree to take it. Even if 50% or 40% or 30%, it's still going to be way more demand than we have supply. And it's going to be way more demand than we have supply for several weeks. So, anyone that expects this process is going to be quick or simple or easy, their expectations are too high. It's not. Stuart or Dr. Wayne, you have anything to add to that?
Okay, next question. If the Lake Cumberland District sets up a clinic to inoculate those age 70 and older, and they end up with more doses than willing participants, how will organizers fairly determine who to give the next extra doses to?
Yeah, well, initially what we're going to do, whenever we are directed by the State Department of Public Health to start ordering the vaccine for phase 1B, we will do so. And as soon as we have confirmation that some vaccine is coming, we will open up the phone lines to take appointments. And you've got to understand there's going to be a lot more demand than there is supply to begin with. Now, at some point, we're going to maybe have the problem that's being asked in this question. But in the beginning, it's going to take people calling in. We'll give appointments until all the slots are full. And then we won't take appointments again until we have more vaccine. Now, I'm only speaking for the health department. There may be other providers that get brought on to do some vaccinating, and they'll have to handle it in whatever way that they see fit. I assume that all the providers will be expected to stay as close as they can with the phases that's approved at the particular time. But, if other providers may use a different scheduling strategy than what we're using, but at the health department, that's what we intend to do. What would we do with any doses that were left over? Well, the same thing that we've done with phase 1A. All across the state, every provider has been encouraged, if you have 1A vaccine and you can't find anyone eligible in the 1A category to take it, it's okay to move to 1B. 1B is the 70-year-olds and the first responders. Well, what we did with our surplus vaccine in our counties was we vaccinated first responders. So we've pretty well taken care of the fire and the police and so forth too. And if we get several months down the road where we're ready to move out of phase 1B and there's some vaccine left over, we would just move into 1C, and it would be on we would open up the appointments and people could call in, and we would schedule until the appointment slots were full, and then we would put on our answering machine, no more appointments, call back next week. I wish there was a better way to do it, but that's the best way. I know people have asked us, why aren't we taking a waiting list like some places are? Well, I don't see the point in having a waiting list when you're on a list you may not get called for 2 or 3 months. If we've got a demand in our district for 25,000 or 30,000 70 and older folks to get the vaccine, and we're only getting 2,000 vaccines a week, I don't want to be the one or to ask any of my staff to make the decision which 2,000 of those 20,000 people that's on the waiting list are going to get it. I don't know of a better way than just say, when we have appointments, we'll schedule until the appointments are full. I don't want to give people the false sense of security if their name's on a list that they're going to get called anytime soon. And again, I don't want to be put in a position of trying to decide if I've got a waiting list of 20,000 people and 2,000 doses, which 2,000 is going to get it. That's going to leave 18,000 people treated unfairly. Again, there's going to be more demand than there is supply, and everyone deserves an equal shot at getting one of those doses when it's available. And we'll open the phone lines, and And if you get through and get an appointment, that'll be the way it works. Of course, over time, it'll get better, but in the beginning, going to be a lot more demand than there is supply.
So let's just keep our fingers crossed that there will be other providers out there.
Well, it's not a matter of providers; it's a matter of vaccine.
That's true.
You got to have the vaccine. You know, if we were given 20,000 doses, we would figure out how to get it administered very quickly. That's not the issue. The issue is it's going to trickle in for a while.
True. Okay, next question. Does the district know of any providers in the 10 counties, the Lake Cumberland district, who had to throw prepared viable doses away due to restrictions on who can be vaccinated?
I'm not aware of that happening anywhere. Dr. Wayman, are you?
Nope.
No.
As a matter of fact, there are a few places in our district that has gotten more than 10 doses out of a vial. So we call those angel doses. So if anything, we've not wasted any doses. We've actually made doses and been able to put one more dose out.
Yeah.
Stuart, you were breaking up as you were talking there.
Okay. Am I clear now?
Yes.
I was just making the point that out of some of the providers, the hospitals and the health departments in our district, that some of those actually have gotten an extra dose out of a vial, and we call those, they're called angel doses. So if anything, we've actually been able to provide an extra dose rather than waste any doses.
So there's some questions in the chat. One is, and I think we've answered it already, what's our plan when we get vaccine? How will the public be informed, and how will we go about doing it? Well, the public will be informed very likely. We'll post it on our social media page and on our website. We could have the radio stations announce it too, but you know, my guess is there'll be so much demand initially, we won't need to announce it on the radio. We'll get every appointment filled very quickly. Just announcing it. And what we'll do is, you know, if we know we're getting 100 doses for a certain county, we'll open up 100 slots and we'll take the first 100 people who get through and give them an appointment. And then we'll change our answering machine to where it says the appointments are full. Call back the next time we have appointments. Now, whether we'll do it through a drive-through or do it in our clinic, it depends on how much vaccine we have. I mean, we will do it in our health departments as long as we think we can do it in our health departments, you know, safely with social distancing and so forth. If we were to get a big giant supply, we're trying to move fast, we might set up a drive-through clinic or something. You know, it just depends on how much vaccine there is available, how we would handle that. The next question, Dr. Wayman, did the particular vaccine we got in the first round, that was Moderna?
Correct.
Yeah. And that's the one where you need to wait 4 weeks after your first shot.
And this is the one that we will continue to get because we don't have freezers for the other one.
Yeah. The other one requires a extremely cold storage, and really I don't know that there's cold storage refrigerators anywhere in our district, anywhere. I think a couple hospitals had ordered them, but I don't know if they've received them yet. So.
Just one thing I want to make sure is clear on the question that was asked about how we'll do that, whether it be drive-through or outside, and as Sean said, we're not sure yet. But I want to make clear that we can only answer those questions for ourselves, for the health department. As other providers, they may choose to do other things. So you may see one provider do a drive-through and has to do something different. So just keep that in mind. The only thing we can really answer for is ourselves. And I think I'm still breaking up some, so.
You are still breaking up some, Stuart.
Yeah. So the point I was making again is we can only answer for the clinics that we host. We can't answer, you know, for other providers. They will set it up in the way that
can't hear you at all now.
Oh,
Gave him a new microphone. Maybe that'll work.
Okay. Are we ready to move on, Stuart? Or are you gonna? All right. Next question. I see the district is asking for patience. I'm curious if the district is anticipating or planning for a ramping up of vaccine availability with the 2 current authorized vaccines, as well as AstraZeneca or Johnson & Johnson vaccines that are expected to seek FDA approval in the spring.
Dr. Wayman, you want to take a shot at that one? I gave an answer, but it's pretty narrow. You want me to read my answer and you expound on it?
Oh,
My answer was, as soon as the CDC and the Kentucky Department for Public Health approves any vaccine, we're willing to give it as long as it's been approved and it's available to be given. So we'll use them as soon as the FDA says they're safe, and the CDC and the Kentucky Department for Public Health and the FDA says it's safe, and they can start shipping them to us. I assume we'll use them as long as we can store it and everything appropriately. Do you have any additional insights, Dr. Wayman?
well, what I do know about Johnson & Johnson is that they may have production issues, so they may be later than was expected. But when they finally do stop producing it, it'll be an easier vaccine to store because it only has to be in the refrigerator, so that's a real plus. And we will definitely use it when we get it.
Yeah. But, before we get into the last question, my heart is with the 70 and older age group. I know that is where we have 75% of our death and 50% of our hospitalizations. And, I can see that there's a lot of people that's trying to maneuver to get ahead of them on the priority list for getting the vaccine. And that's heartbreaking to me. But you can rest assured we are at the health department here trying very hard to be an advocate and to fight for the 70 and older age group. We know that that's the group that needs this. Now, phase 1A was medical providers, hospital providers. Of course, you need the hospitals and you need the medical providers to be able to give the vaccine, and you need those systems working. I mean, I don't know if the general public knows, the hospitals as of today are in a very bad situation. I mean, in our district, almost all the ICU beds are gone. At the state level, most of the ICU beds are gone. It's becoming extremely difficult for hospitals to even transfer someone out to another hospital because other hospitals aren't able to take them. We are almost at the brink of buckling our hospital systems right now with the amount of COVID-19 hospitalizations we have. So, and part of the problem at the hospitals is you have a lot of staff that end up getting infected and having to be off because, they're constantly being exposed to people. So, I mean, getting the staff, medical staff, that's important. Getting first responders taken care of, medical or fire and police and so forth, that's important. Then we move it into school staff and 70-year-olds, and we want to get to those 70 and older as quick as we possibly can. Nobody wants that any more than us. So, I hope we can get there. And it breaks my heart that we won't have 20,000 doses the first few days. We won't. We may need 30,000 doses, and we may get 2,000, and we're not going to have nearly enough. And, people will be calling us and we can't give them an appointment, and they'll be telling us all of their health conditions and all of their problems, and we will sympathize with you, but we can't make vaccine appear out of thin air. There will be available what's available, and we will make the appointment slots open, and we will give them to the people that qualify for it. until they run out. And then when we get more, we'll do it again until this is over. But my heart's with you.
Thank you, Sean. Are there any questions in the chat box, Sean?
There is another question.
Let's see. There's one that says, "What if you get the first Moderna shot and then there is no availability when it's time for the second shot? Do you have to start over?" I'll let Dr. Wayman answer that.
No, you do not have to start over. The minimum period between the first and second dose is 28 days, but after that you can go out up to a year, I would think. 50% of people who receive the first dose seem to be protected and have antibodies. So that's a good thing, at least for after a one dose issue.
It's certainly better to get the second dose. That gives you your maximum protection. But if you have to wait longer than the minimum, you don't have to start over. You're going to get the benefit of getting that second dose boost, even if you have to take it, several weeks or months later. So,
in fact, there are really no vaccines that if you miss the timing that you have to start over.
Yeah.
You just continue.
So no, you've not wasted anything. It's just you want to get it as soon as you can so you have the maximum benefit from the vaccine, but there's no upper limit, or at least not for several months. There's another question. How long is quarantine? Meaning after the first person is released, how long does the rest of the household have to remain in quarantine? Stuart, why don't you answer that one? That's changed a little bit, and I'm sure you probably have more familiar with that than me at this point.
Okay, so Tracy, I hope I'm coming through clear.
Is it coming through?
Yeah. All right. So CDC's changed the guidelines a little bit. Now, if you are asymptomatic, or not let me say that wrong. If you do not have any symptoms, then you can be released from quarantine 10 days after your last exposure, or you can be released with no symptoms 7 days after your exposure, as long as you test negative on day 5, 6, or 7. So it's 7 days with a negative test or 10 days without testing, as long as you're not showing any symptoms. And I hope that's right. I'm going to look at Dr. Wayman and make sure. She says yes.
Okay. Are you ready for me to go with the next question? All right.
Sure.
With positivity rates and adding such numbers, why is in-person school remaining?
Well, because there's a lot of very influential politicians that thinks that's the way it ought to be, and they make that decision. I'm not sure it's the best health decision. I know there's different studies that suggest different things. What I do know is when we went back to in-person instruction last time, and it was just a couple, 3 weeks later before this last major spike started that we're still not out of. I know that when we suspended in-person instruction, the spread did plateau temporarily. I know that now that in-person instruction at some level has resumed in most schools in our district. When you look at there's a donut chart on our website that says, where were people at before they were isolated. Over the last few weeks while schools were out, it had dropped from being in first place down to, fourth or fifth place. And now it's moved back up into second place, and we'll probably pretty quickly get back into first place. My guess is within 2 or 3 weeks, if there's going to be a surge, it'll be because of the school situation. I hope there's not. I hope with all my heart that I am wrong, that the schools being in session doesn't contribute to another surge. I'd love to be wrong about that. Kids are the least likely group to show illness if they contract the disease. So the kids are pretty well going to be safe, you know, from a health perspective, wherever they are. That's one of the arguments for having school is they're going to be safe wherever they are because they tend not to get sick. That's true. But that doesn't mean they can't catch it and spread it. If they take it home, mom and dad get it, mom and dad take it to work, they take it to church, they take it to wherever they go. It can impact community spread. And again, I hope I am wrong about that. I hope 3 or 4 weeks from now, our numbers are going down, not up. That would thrill me. I guess we'll know over the next couple or 3 weeks. But the reason why they're in session is, you know, there's people in positions of power that's important to them that they be in session, and that's what we're doing. So, what more can I say?
I can just let me add a couple of things to that as far as there are some new requirements. So since they are allowed to go to school, they are supposed to be following. If the county is in the red zone, which every single county that we have is in the red zone, they have to consider. They should be considering remote learning, and if they're not doing that totally, they have to be doing a more aggressive hybrid. So they need to be doing a system whereas they're limiting the number of people, the number of children, the number of people total that are in those buildings. They must now maintain the 6-foot spacing at least. They must mask at all times. And I will say, just to our people listening, if you find that's not happening, you know, you can feel free to reach out to the school's governing body, Kentucky Department for Education. So they would have the authority over the schools to look into those type of things.
You know, I believe the schools are trying real hard to follow the guidance. You know, I believe they're putting very good effort into following the guidance. You know, but everyone has to remember, following guidance does not ensure safety. Following the guidance reduces risk. You can't eliminate risk during a pandemic. So, you know, that's why we say wear your mask. Don't be around crowds any more than you have to be. Be around as few people as you have to be for as little amount of time as you have to be. Because whether you're masked or not, or whether you're 6 feet apart or not, the more time you're with somebody, if you're in an enclosed space, if there's more people in that space, if there's a lot of talking going on, all that stuff, you know, reduces the effectiveness of staying 6 feet apart and wearing a mask, you know. So, you know, schools is a difficult environment. You can follow all the guidance and still have spread because, you know, a lot of people in a small space, it's just a difficult thing. And schools can do the very best that they could do following the guidance and still have issues. So I don't, you know. So the lady that asked the question about how long you quarantine, Stuart, let's give a scenario. Let's say there is a household member who is a case, who is isolated. Mm-hmm. When can they come off isolation? And then what about the rest of the family members who were close contacts? After the person comes off isolation, how much longer does the close contacts have to be on quarantine? Okay. Or Dr. Wayman can answer that. She may be the expert. So she's more expert than I am.
Yeah. I'll stab at this. If I'm wrong, Dr. Wayman can fix this. Isolation means that you are a positive case. So you have COVID. So if you have a family member in your house, let me use myself as an example. Let's just say that my wife has become positive for COVID. So she has a 10-day period that she has to remain in isolation as long as she is improving from her disease and has not been hospitalized. If you're hospitalized, it lasts a little bit longer. It can go to 20. But let's just say that she's getting better. Hers is 10 days. If I was not able to isolate away from my wife, then my quarantine not only goes her entire time she's in isolation, but I have an additional 10 days from my last contact with her. If I last had contact with her on her last day of isolation, I have 10 more days to go from that. So that's without testing. Now I could do the test out, but let's make it simple and just talk about the 10 days here. So if I cannot isolate, then it's going to be 10 days from her release. No matter what, it is always, the question says, since the first exposure and quarantine began. What you really need to be thinking about is the last exposure that you had instead of the first exposure that you had. So it's going to be 10 days from your last exposure. I hope that
Perfect.
That clears that up.
I don't see any more questions in the chat.
I don't have any more questions either, Sean.
All right, so as we are winding down, if you are one of the, sorry, I dropped my ink pen. If you're one of the people that's listening in live, we are glad you've joined us. If you have a question, feel free to ask it. I'm just going to make some closing comments to make sure no more questions pop through. It is a good time of the year to get your flu vaccine also. It would not be a good time to get flu and COVID-19. Do remember, COVID-19 is still spreading aggressively in our communities. Do remember that you still need to wear your mask and social distance. Even if you've been vaccinated, you need to do that. We know that the vaccine keeps you from getting, if you have the virus, keeps you from getting sick, but what we don't know is, can you still spread the virus after you get the vaccine? I think I said that correctly, Dr. Wayman. The verdict's still out on that. So, social distancing and masking is still going to be around for a while until we see the new case rate or the 7-day average incidence rate, or however you want to look at it, until we see that go way down. There is a time when this is going to be over, but wear your mask, social distance, try to avoid crowds. Keep your just keep following the guidance that we've been talking about for a long time, and hopefully we can get through this. We certainly wish there was a much greater abundance of vaccines so that we could move through all of this much quicker. It's not a question of are we willing to do it. It's a question of, is the vaccine available? So as soon as it's available, we'll take care of it as best we can. Anybody have any closing thoughts?
I just want to say, on top of the safety precautions that we asked you to take, we're asking you for one more thing, and that's patience. That you, as Sean said, rest assured that as that vaccination comes in, we want to get to you, and we will do everything in our power to get to the next phase, the 70s, and then the next phase of people after that. You can be confident in the health department is putting all our efforts in working towards that.
Yeah. And I don't see any other questions, Tracy, so you want to wind this down?
Yes, I guess that's all we have for today. If you have questions at any time, you can send those in to us either through our Facebook page or our website. And we will be back on in 2 weeks, which will be January the 27th, I think, at 2 o'clock.
Yeah, so one more question popped in, Tracy.
Okay.
Says, how long are they currently saying you have antibodies if you have had COVID-19? That'll be a Dr. Wayman.
Well, I have just the paper here, and it looks like definitely for 6 months. But the whole story is a little bit more complicated than just antibodies. Antibodies can wane, but there is a whole immune system in the background that can reproduce antibodies if it is once again attacked. So there are what we call the T cells, which then stimulate the B cells, which produce antibodies. So the B cells, once they've produced antibodies, will slowly shut down, but the T cells will still have the memory. So if you are reinfected, you will stimulate the T cells, which then will help the B cells to make more antibodies. So that is what usually happens with most other diseases, and hopefully that's what will happen. But since we've only had this disease around for a year, we have to actually see the data before we can write it in stone.
Well, one thing I can say to add to this, Dr. Wayman, is let me get my file pulled up here. Just take a second here. My computer's doing something. So out of all of the cases we've had, last night it was 15,762. So we've had 32 cases out of 15,762 that have a reinfection. Now, of those 32, could some of them had a false positive test earlier? Maybe. But even if it is 32 out of 15,762, I mean, you've got a very small percentage of people testing positive twice. Extremely small percentage of people testing positive twice. So, it is possible, but it's extremely rare to catch it a second time. Extremely rare. So far, I mean, who knows what the future holds? I'm just telling you what we know as of today.
Every individual's immune system is different. So the ones that are more healthy, that have a better diet, that have good vitamin D levels, that maybe have good vitamin C levels, that get enough sleep. More recently, there's been some discussion about high fructose corn syrup, which can affect the immune system, or at least the vitamin D metabolism, which affects the immune system. Chemicals in the environment can affect the immune system. So if your immune system isn't great, then you're more likely to get reinfected because all those systems will not be optimal.
Yeah. So our reinfection rate has been about 1 out of every 500 people. And if those are true reinfections. So again, and I think that's what the gentleman was, or the lady was asking, was how safe are you if after you've had it to not catch it again? So so far as our reinfection rate, pretty safe. And I don't see any other questions. So Tracy, you've signed us off once. Thank you all for joining us. We'll see you in a couple of weeks.